All right, so this is part 2 because I just got cut off. But anyway, I was talking to one of my friends who said, oh, they didn't call me and tell me my blood work was bad, so it must be okay. No, if you had blood work done, please know your numbers. Call and find out what's going on. Hi, sorry, I got disconnected. Don't rely on somebody else to say, okay, this was bad or not. It's your health. Make sure you take care of it. I'm going to be signing off. Thank you for all the questions. Just want to make sure, and I'll say it again, if you get your blood work, I was talking to one of my friends, he said, oh, well, they didn't call me, so my blood work is fine. No, they could have lost your blood work. You could be half dead. And now 6 months later, somebody be like, oops, we should have called him. Poor thing. They will cry at your funeral. Hi, Onyx. They will cry at your funeral. But unless your family finds out, you really need to make sure. If you get blood work, if you take the time to go to the doctor to get stick with a needle, come on now. Hey Chandra, if you get stuck with a needle and all of that, shouldn't you just follow up? If you get a CT scan or all that, no, a mammogram, God knows if you get a mammogram, prostate exam, any of that stuff, find out what is going on with you. So my whole post earlier, y'all, I'll post it. I just did the whole heart disease piece. This is the follow-up because I'm in Uber trying to get to the airport, probably getting ready to miss a flight. But it really is important. Know your numbers. And it is now almost March. If you have not scheduled your annual physical, go ahead and schedule that. Men, yes, you need a finger in the booty. You need a prostate exam. And you need some blood work. Hi, Clint. Happy birthday. Yesterday. You do need to make sure that you are getting checked out. I will do one more synopsis because new people came on. Total cholesterol. I'm stepping on your toes, Onyx. You do need an annual physical. Why do you pay so much money for health insurance and have health insurance and you don't even do anything about it? Why do you do that? Why? We would not. I want y'all send me the $300 or $400 y'all spend on health insurance. Just send it to me if just y'all want to give it away. Or if you don't have health insurance, that's the other sidebar. Particularly for women, every state you can get health care, mammograms, and pap smears absolutely free in every state in the country. So that's a sidebar. And if you don't have health insurance, inbox me and my staff will help you navigate the healthcare system. If you take medications, take them as prescribed, and then know your numbers. It is your health. Annual physical, go ahead and schedule it. Women, mammogram, go ahead and schedule it. Pap smear or vaginal exam, go ahead and schedule it. If you're over 50, you need a colonoscopy at 50 and then every 10 years. Or if you have an abnormality, you will need to follow up earlier. Men, you need a colonoscopy over 50, at least one, and then every 10 years unless you have an abnormality. And the doctor says, please follow up. Guess what you're supposed to do? Follow up. Sidebar, we were talking about heart disease earlier. Guess what's related to heart disease? Dental work. Do you know if you have a messed up mouth and lots of cavities that the bacteria can leave the mouth, go to the heart, mess up a valve, and you're having open heart surgery just because you got a cavity that you didn't get taken care of? So now, heart disease, blood pressure less than 120, LDL, which is your bad cholesterol, less than 100. We really say less than 70. Good cholesterol, greater than 60, 70, and then total cholesterol less than 200, blood pressure less than 120. Get your annual physical exam, take your medications as prescribed, have open dialogue with your doctor. I will end with this. I help develop these national questions. It's called Ask Me 3. Anytime you go to the doctor, the pharmacist, the dentist, Indian chief, anybody related to your health, know the answers to these 3 questions. Number 1, Doc, what is my main problem? 2, why is it important? And 3, what should I do about it? If you get those answered in every doctor's appointment, every pharmacy interaction, then you have it down pat. It's called Ask Me 3. Thank you all for listening. Repost it. Look at part 1. I got cut off. And y'all, hey Keith, I'm gonna need some help because I'm going to miss this flight. And I have meetings all day and then I need to come back. All right. Y'all have a great, healthy day. I will see y'all soon. Thank you for listening and repost. Toodles. I'm out.